Hello, I'm Dr. George Case, and I have a 2-day stop smoking program that works better than anything I have seen anywhere in the country. Not because I do it, but because I listen to people that come in here and get treated. But I think you need to know that most of the people that come here really don't believe this will work in 2 days. So they have a lot of questions, and that's what I'm going to try and do right now is answer all the questions. First thing you need to know is you must need to quit, must want to quit. You must want to quit. Not that your wife wants you to quit or your kids want you to quit. That doesn't count. You must want to quit. Most of what happens in stop smoking programs is between your ears. Your brain needs to know you want to quit. No one can make you quit. I can't make you quit. Nobody can. You also need to know you're addicted to tobacco products for the rest of your life. That's all products. Snuff types products, cigars, cigarettes, you name it, it's addicting. These products that I think they call them vapes or vaporizers or something like that, are fooling you because you're still putting nicotine in your system. Nicotine is a deadly chemical. I don't know why people don't get that, but you need to know it is a deadly chemical. We use it you'll see it in farms where they'll spray it on a lot of the plants to kill the bugs. Most of the people who return for follow-up treatments are people that didn't believe anything I just said. They go to a wedding and somebody will say, "Hey, you want a cigarette?" "Okay, yeah, I'll just smoke one." Now they've normally had a couple of drinks, and that drops your inhibition, and you really think you can do anything. So they smoke one cigarette, and then they smoke another cigarette, and then they go buy a pack. And by the time they get here on Monday, they're almost through the pack. Just so you understand what I'm talking about. How do we do this? I am board certified in treating acupuncture, but I use a laser, a very low powered laser. It looks like a pen laser, a pen point laser. Very low powered, but it's very expensive. It's made specifically for this kind of work. I treat 20 different points on the body, mostly in the ears, nose, hands. The big thing people need to know is, why does this work? I've been a chiropractor for 35 years, more than that actually, and I find that it helps patients get better if they understand, first of all, what the problem is. That means I have to sit there and talk to them for a few minutes to find out what's really going on, what's really behind it, what did they do to get hurt, and sometimes they really don't know. But when I explain the mechanism behind what happens in the body when they do get hurt, and they understand how that mechanism works, they're less likely to go out there and do the same thing over again and make it worse. So I think it's important that you understand why this works, because this does work. When we were going through the classes to get my diplomate in addictionology and compulsive disorders, they made a big deal out of this, and I can understand why. Because this is not taught in medical schools. I don't know that this is taught in many schools at all in healthcare. Because healthcare is basically designed by a pharmaceutical company program that's taught to medical students. And if they don't learn it in that order, they don't buy it. They don't think it's real, which is fine. That's their prerogative, but I happen to know after doing this for 19 years, this works really, really good. People come in here from Key West, Florida, from New York State, from Colorado, from Virginia, and I'll be the first to say they tell me I spent 3 months trying to find somebody that does what you do and nobody has a clue what I'm talking about. So, how does it work? We have chemicals in our body that are made by the body called neurotransmitters. And neurotransmitters are the mechanism our body uses in the neurologic system, in the nerves, to enable one nerve to talk to the next nerve. Now, in the case of an addiction, and I don't care if it's a smoking addiction, a cocaine addiction, a meth addiction, the addictions are in the same place in the brain, mostly in the emotional center. You want to feel better. Cigarettes do that to a lot of people. I used to like to smoke. I smoked for 20 years. I know how hard it is to quit. But the neurotransmitters, before you ever started to smoke, the neurotransmitters were taken, the levels were taken care of by the brain, checking on itself to see if the levels that the brain needed to function were at the right levels, and it would tell the body, I need to make more of these, and like dopamine or serotonin, neurotransmitter chemicals like that. And the brain and the body would work together and get the levels back up where they needed to be. But then you started to smoke, or you started using snuff or some other product, and the brain is a unique mechanism. It has like a screen door on it. And the screen door doesn't allow everything that's in the bloodstream to get into the brain. Unfortunately, the screen door, called the blood-brain barrier, will allow legal and illegal drugs to go through that screen door. I call it a screen door because blood-brain barrier confuses a lot of people. That's really all, it acts like a screen door. So, when that screen door lets the nicotine go into the brain can use it just like it was a neurotransmitter. So, you start smoking as a kid usually, and you smoked many years, and finally someone got through to you and said, this isn't good. This is not good. Our body needs and our brain needs oxygen and blood glucose to function. And when you put smoke into your lungs, you shut down the ability of the body and the brain to get all the oxygen into the bloodstream that it needs. So whatever way or whatever you were told that got you into thinking I need to quit smoking, good. I don't care how you process that in your own mind. The bottom line is you're thinking about quitting smoking. So when I stimulate when I turn on the little laser and I touch all the different points in the ears and the hands and the nose, I'm letting the body take the energy from the laser, take as much as it wants, take the positive or the negative energy that it wants, and use it to stimulate neurotransmitters, chemicals, the chemicals we're talking about. And when that happens, there's no need for the body to be looking for more nicotine. So, you start smoking as a kid, you decide to quit smoking, and you decide that you're going to quit smoking, and by the end of the first day, you don't even like yourself. Nobody else likes you either. And when we come in with a laser and stimulate the neurotransmitter chemicals, we're going to get them back up to where they were before you smoked. That's how this works. When that happens, it's not looking for nicotine. Okay, that's the secret to this. So, people want to know, what can I do to make this work even better, or is there anything I can do on my own before I come and see you? Before I spend $197 for this program, what can I do? So, here's what you can do. Draw a line, a vertical line right down the center of a sheet of paper. On the left side, put down all the reasons I want to quit smoking. And on the other side, put down all the reasons I don't want to quit smoking. You're going to do this at a quiet time when there's nobody around to interrupt you. You're going to do this with the thought in mind that no one will ever see this but you. And when you get all done, look at your list. Do you really want to quit smoking, number one? And if you do, pick the 5 biggest reasons that you want to quit smoking. Write them on a 3x5 card. Stick it in your pocket. And every morning when you get up and you're putting everything in your pocket, you hold that 3x5 card and you read that in front of a mirror, out loud, so your conscious and subconscious mind knows you want to quit smoking and why you want to quit smoking. Very, very important. Before you go to bed at night, do it again. Make that the last thing you do so it's ingrained in your brain. This guy really wants to quit smoking. So, it's a 2-day program, and the question is, what if I get through day 2 and I still need this? I still want a cigarette. Everybody's addiction is different. I've been doing this too many years. I know for a fact everybody's addiction is different. Half the people quit on day 1. The other 40%, because we have about a 90% success rate, the other 40% will quit on day 2. There's about a 1%, maybe 2% of the people, at the end of day 2, they still want a cigarette. They've cut way back, but they still want a cigarette. I understand that. Here's what you do. You pick up the phone on day 3 and say, can I come in for another treatment? And I'm going to tell you yes. And I'm going to tell you it will not cost you anything. It's free. I want you to quit. I want you to be healthy. And that's the only way I know to do this. Okay? Other things you can do before the program. You need to clean out your ashtrays. Throw away every cigarette butt you can find in your car, in your house. If you find one, you'll smoke it. I said, oh my God, you will smoke it. I've heard this thousands of times. You can stop eating and drinking addictive chemicals. Chemicals like aspartame. Aspartame is a chemical in sugar-free drinks, sugar-free food, sugar-free cereal. It's supposed to make you healthy. It was developed for chemical warfare in World War II. It was never supposed to be used by the public. But the food industry got in there, and money talks when it comes to Congress. They won. And aspartame is in our diets. Alcohol. You don't have to quit drinking forever, but you'll do a whole lot better if you can have no drinks, no alcohol for a couple of weeks. Sugar. One of the biggest toxins in the American diet. Toxic foods, sugar. Okay? I'm not making this stuff up. I've done tons and tons of research on this. Caffeine. You do not have to quit drinking coffee totally. You would have a big problem probably doing that. But do this. If you get up in the morning and you have a cup of coffee, break up your routine. If you get up and you go to the bathroom, then you take a shower, then you have a cup of coffee and a cigarette. Get up, do it a little bit different. Get up, go to the bathroom, have a cup of coffee. No cigarette. Only drink as much coffee as you want, not because you got to drink the whole cup because that's what you always do. Maybe just a sip or two is all you need to taste the coffee, put the cup down, go take a shower. Break up the program inside your head. That's what your brain thinks you're going to do. Okay? Street drugs, like I said before, all the stuff, the illegal drugs and the legal drugs, go through that screen door into the brain. Stay away from that stuff. It's just like alcohol. It drops your inhibition and makes you feel good or whatever it does. I've never tried it, but it's going to be a downfall when you're trying to quit smoking. Now, you've done day one, and the difference between the people in day one and day two successful is the day one people's brain processed the neurotransmitter chemicals up to normal on day one, and the people on day two, their brain was a little bit different, and it processed those chemicals up to normal on day two. You may come in on day two and say, God, I want a cigarette. I'm crawling the walls. When I treat you, everybody tells me the same thing. That second treatment stops it. I'm relaxed right on the spot. I'm not looking for a cigarette. So, but you get during day one, say, and you want a cigarette, or day two, you want a cigarette. Brush your teeth. If you can't brush your teeth wherever you are, go to the drugstore, get a little tube of toothpaste, bite off a little tiny bit of toothpaste, get one you don't like, bite off a little bit, slush it around in your mouth, and swallow it. Because you stop and think about this. When you want a cigarette, there's a taste in your mouth that's unmistakable. You want a cigarette. You kill that taste with toothpaste, and you don't want to eat or drink anything after you brush your teeth or slush the toothpaste around, change the taste in your mouth. So, like I said, $197 is what this costs. It covers both days. The third day, like I said, if you need to, it's free. So obviously I don't do this very often on the third day. But the offer's there because we want to help you. The next step is up to you. You have to pick up the phone and you call 919-772-3423. We're in Garner, North Carolina. And just an aside, a lot of people have asked me this, that live, say, 80 miles away. Is there any chance you would come to our company and do a program like this on the weekend? Answer is yes. Talk to me about that too. Okay, that's all I can tell you about this. Thanks for watching. If we can help you, give us a call.